Thank you so much for joining us today on this live session as we discuss erectile dysfunction. This is the Intimate Matters podcast, your go-to podcast when it comes to issues about sexual and reproductive health. We talk about your intimate matters because we know that your intimacy matters. So today we want to look at something that greatly affects many males. Today we want to talk about erectile dysfunction. Now, this has been confused, right? We have a whole lot of 2 minutes men, 2 minutes woman, the whole thing. A man that cannot last, being peddled around every day. So today we want to look at, we want to look at it in depthly and actually realize what it means to be somebody that suffers from erectile dysfunction. Because we're seeing a whole lot of persons, going to get drugs as the case may be, over-the-counter drugs, sometimes abusing sexual enhancers just because they feel that they need to, perform sexually. So today we want to look at erectile dysfunction. But at the simplest definition of it, erectile dysfunction is the inability to get an erection or maintain an erection long enough for sexual intercourse. So it comes with the ability to even have it. So are you able to have it? Then if you're not able to have, if you're then able to have it, can you maintain it for long enough for you to have sexual intercourse? That is simply the definition of erectile dysfunction, as the case may be. So some people are able to have it. Some people struggle. Some people are not even able to achieve erection. Some people struggle to achieve it. And some people, when they achieve it, they cannot keep it long enough. So that is simply what erectile dysfunction is. The ability for you to have and to maintain an erection for sexual intercourse. Now, oftentimes, in as much as we look at erectile dysfunction as a disorder that affects a physical organ being the penis, your feelings play a major role when it comes to erectile dysfunction. How do you feel when you are into the process of having sex? Do you feel relaxed? Do you feel tense? Are you anxious? Because of maybe the situation surrounding the relationship as it pertains to what exactly it is you want to do. Some people feel tense and feel anxious while going into the process of having sex, especially for men. So there is this pressure to perform, there's this pressure to deliver, if that is what we could call it, right? So there is that huge pressure. So it's important for you to know that this also affects your erectile function. Now, before we get into it, this is just an overview. We look at substances, how you use substance and alcohol. By substances, I mean drugs. So it could be drugs formulated, chemical drugs that are formulated. It could be herbal substances. It could be natural substances. How do you use it? Then it could also be an issue due to other conditions. So you're having another condition, and part of the side effects of that condition manifests as erectile dysfunction. It could also be because of certain drugs that you're taking, like medication. So you're suffering from a certain illness and you're being asked to take this medication. And the side effect of that medication is that it's going to affect your ability to get sexually aroused. That's it. Such medication could be like cancer treatment. So that is what you need to look at. So another form for erection, another name for erectile dysfunction is impotency or impotent. So I know that many people have come to know that, many people have come to assume that impotence means infertile. So they'll be like, why couldn't you impregnate your woman or your lady, as the case may be? They'll say, I was impotent. No, it doesn't work that way. Because somebody who suffers from erectile dysfunction can still, there's a possibility, can still get a woman pregnant. So erectile dysfunction means that you are unable to have or sustain an erection. Now, that doesn't mean that anything is wrong with your spermatozoa. And as long as your spermatozoa is good and functioning, you can get a woman pregnant. So let's rule that out. So when you say, my man is impotent, you're actually saying that he does not have the ability to have or sustain an erection. That's what you mean. It does not mean that he lacks the ability to get you pregnant or to get somebody pregnant. So if you've been using impotency as infertility, impotency is not equal infertility. Impotence is actually another name for erectile dysfunction. And I hope that, we've cleared the line on that. So we jump right into it. What are the types of erectile dysfunction? Now, broadly, it could be looked at two ways, maybe physically and psychological causes, or physical and psychological type. But I want to break the physical aspect into some, subtypes. We have vascular erectile dysfunction. Now, when we talk about vascular, we're talking about vessels. in this context, blood vessels. And before we discuss this, I would just want us to run through the whole arousal process, how erection happens. Now, erection is a psychological and also a physiological process because it starts with something in your brain. Something has to stimulate your brain to want to get erect. So it could be touch, it could be smell. Now, don't be surprised. Some people are aroused by smell. If you watch some of our podcasts, if you watch our podcast on kink and fetishes, you see that there are people who are sexually aroused by what they smell. There are people that need to smell their partner's armpit, for example, to get sexually aroused. So whether you see, you smell, you hear, some people hear, sometimes some people may hear a morning sound and they get sexually aroused. Sometimes they hear the sound of a loved one, they get sexually aroused. Or what are your tests? So you test something and it tests like something that you know, it can get you sexually aroused. Now, so when this stimulus gets to your brain and your brain is like, and gives your brain this sexual impression, your brain sends a signal. And what the signal does is that it sends a signal to your heart and it pumps blood to your blood vessels. Now, your penis is basically some tissues, some elastic tissues, right? That's what makes up your penis, some elastic tissues with blood vessels running through them. So when this blood is pumped into these blood vessels, they expand that elastic tissue, and that is when erection happens. So as they expand those elastic tissue, as the blood flows into the blood vessels, those elastic tissue, as they expand, they constrict the blood vessel that blood cannot run out again. So that organ stands, and that's what we call to have erection. So it's essential that we establish that as we talk about the vascular erectile dysfunction. So when we talk about a type of erectile dysfunction that is vascular, it means that there is something wrong somewhere, right? It means that there is something wrong with the blood vessels that send blood to your penis. Either they have constricted, they cannot collect the blood, or the valves that, I talked about the fact that when the blood pumps in, it doesn't go out again. Or maybe there's something wrong with those valves. So the valves cannot hold the blood in place. So as the blood comes in, it comes out. So the penis cannot stand. So erection cannot happen. So that is what it means. So when we're talking about a vascular erectile dysfunction, it means that there's a problem with the blood vessels. Either the blood vessels themselves, where they cannot expand enough to collect the blood that is pumped towards it, or the valves of the blood vessels that they cannot hold the blood that has been pumped in. So if they cannot even collect the blood pump, that's when most likely the person is unable to even have an erection. But if the valve cannot hold the blood inside, it means the person cannot maintain an erection. Now, vascular erectile dysfunction oftentimes is like the most common type of erectile dysfunction. So most time when people say something is wrong with them, in terms of erectile dysfunction, it means that something is wrong with their blood vessels. So moving forward, we have the neurogenic erectile dysfunction. Now, this has to do with the nerves. Now, when I was talking about the physiology of sexual arousal, I talked about how it is essential that the nerves are stimulated. It's the nerve that gets stimulated maybe when you see, when you smell, when you taste something that gives you a sexual impression. So if these nerves have problem, they cannot send the right signal from your brain to your penis, right? So if there are problems with your nerve, you may feel sexually, you may be with somebody you care about and you want to be sexually in the mood, but yes, you're already feeling the sexual tension, but the nerves cannot translate it to your penis, for you to actually have an erection. So what happens in a neurogenic erectile dysfunction is that there is a problem that prevents the signal that you feel from your brain coming down to your penis to cause an erection. So easily what could cause this could be things like stroke. People that suffer from stroke has to do that there's a rupture in the blood vessel in the brain. Now, this rupture in the blood vessel in the brain affect the blood supply to certain parts of the brain. Unfortunately, if this part of the brain has to do with the part that controls erection or sexual stimulation, it means that there will also be a problem. We also have issues like surgery. Maybe you had a pelvic surgery, and in the course of doing the surgery, some way a nerve was tampered with. There could also be trauma that affects these nerve cells, or maybe things like multiple sclerosis. Multiple sclerosis is a form of neurological disorder, so that could be a problem. Now, the next one to look at is hormonal erectile dysfunction. Now, when we talk about hormonal dysfunction, oftentimes it looks as if it's a women thing. It's quite marked in women, so oftentimes people feel like it's only women that have erectile dysfunction. But it's not only women. Men also can have erectile dysfunction. Men can have erectile dysfunction due to hormonal dysfunction too. So we're talking about things that happen because of testosterone deficiency or thyroid issues. So testosterone is like the major androgen, that's the major male hormone that control the male sexual function. If there's a fluctuation in this hormone, either due to, it could be problem with the testes that produce the hormones, it could be problem with the receptors that receive this hormone, whatsoever is the issue. If there's a deficiency, either maybe due to the medication you're taking, due to the kind of lifestyle that you have, it could lead to erectile dysfunction. So let's just know that men also can have hormonal imbalance, hormonal dysfunction. It's quite important to note that. Then the last type of erectile dysfunction is a psychogenic erectile dysfunction. This is one of the most greatly overlooked erectile dysfunction. Psychogenic has to do with the psychological mindset, the psychological state of mind. So how you are affected, the affectation of your thoughts, feelings, and behavior can lead you to erectile dysfunction. I talked about, as we were introducing this topic, I talked about when somebody has to be anxious. So for example, you're trying to impress a lady, you're already anxious, so going there, you may not perform like you should because you're already tense. Now, this tense leads your body to release certain hormones like cortisol, which is the stress hormone, that may affect the functioning of your cardiovascular system and your blood vessels, right? So if you're afraid, you may not be able to sexually function because of the fight-flight reaction. So it's not always every time that there is a problem physically. So that's why it's essential that you look at the relationship you have with your sexual partner. So it could be noticed that as the relationship erodes and corrodes negatively, by the way, that sexual function changes. So you're no more into this lady as you used to be. She doesn't excite you like she used to. You're most likely not to be able to perform sexually. So sometimes that's why you may be with a lady and you can't even have an erection. You see her naked, but you can't have an erection. This is a psychogenic kind of erectile dysfunction. And it's quite common than we actually give it credit for. So some people ask, so when we talk about erectile dysfunction, they'll be like, does it really affect people? Yes, it does. In fact, it's arguably the most common sex-related condition that affects men. That's why we are having a whole lot of 2-second men all over. 2 minutes men, sorry, all over. Because it's like the most common thing. And it often happens like from 40 to some, once a man gets to 40. Now, this is related to so many things. It's related to decline organ functioning, is related to andropause, which is a decline in the amount of male androgen, especially testosterone, is related to decline in the overall body functioning as a man. So from 40, like almost about 50% of men when they get to 40 are going to have erectile dysfunction. So now the thing is that it may even be more, but you know, most people are afraid and ashamed of coming out to actually say that they have erectile dysfunction. So that could be a problem, right? So that's how common erectile dysfunction is. So what are the symptoms? The first symptom would be that you sometimes only have erection before sexual intercourse. When you cannot have consistent erection. I want to say that when you cannot have consistent erection, right? So you want to have sex, maybe if you want to have sex 10 times a week, you only notice you have erection 7 times or 6 times, you are most likely suffering from erectile dysfunction. As at every time you want to have sex, you should be able to have erection. As at every time you have sexual stimulation, you're supposed to have an erection. If you don't, it's an erectile dysfunction, right? The second symptom could be that you have this erection, but you're not able to maintain it. So while the lady is coming on her way and you're feeling like to be with her, your thing has stand giddy, you know, everything is standing. But then she comes in, she owns her clothes, and all of a sudden you are falling. Now we hear things like this on social media, where she comes in and you're about to penetrate and it falls. That's a form of erectile dysfunction. Now the next one could be you do not even have any ability to have erection at all. You are touched, you're stimulated, you're seeing things that stimulate you, hearing things, you cannot Now, the next symptom could be requiring a lot of stimulation before you get an erection. You see, touch me, let me stand. Touch me, let me stand. I know the people in the social media space know what touch me, let me stand is. Touch me, let me stand oftentimes is a pointer to erectile dysfunction. You don't need frequent, yes, you require stimulation to have an erection, but you don't need frequent stimulation. You don't need to require a lot of stimulation for you to either have or maintain an erection, right? So those are the symptoms. If you notice that, if you notice that sometimes you don't always have erection all the time, it's a sometime thing, 7/10, 6/10, 8/10, possibly you have erectile dysfunction. You have the erection, but you cannot maintain it to have the sex, or maybe as you're having the sex, it falls on the way without you ejaculating. That's a dysfunction. If you don't even have erection at all, that's still a dysfunction. If you require a lot of stimulation, touch me, yeah, baby, touch me, I'll stand. That's also another problem. So you need to look into that. So what are the causes of erectile dysfunction? We have circulatory issues. Like I said, the reproductive health of a man is greatly related to his circulatory system because the heart needs to pump blood to the penis for erection to occur. Right? So that is something that should be noted. So if there is issue with the blood vessels, that the penis does not have adequate blood flow have to have an erection and to maintain that erection, then that's a problem. So if anything affects your circulatory system, especially your blood vessels, especially the one that supplies the penis, or the valves of the blood vessels, those two things, the blood vessels themselves or the valves, there could be a problem. There's likely to be a problem. So that's the first cause, circulatory problems. Then we have issues with the nervous system. I talked about neurogenic erectile dysfunction, where the brain or the spinal cord or the nerves that are supposed to work together to send the right impulses to help your body feel and move, including your penis, have issues. Your penis will not respond to stimuli. Don't forget that there are nerves in your penis that when it is touched or whatever, it gets sexually aroused. So if there are issues to these nerves, you won't feel it. So there's also the endocrine system. I talked about hormones. So the hormones is what tells your body to perform certain function, especially testosterone. It's what prompts your penis. So the testosterone prompts the blood vessels in your penis when the blood comes to dilate and collect the blood. So it helps the blood flow. So that could be another cause. If there are problem with your endocrine system, you're not producing adequate amount of testosterone, especially, it could be a problem. So what are the certain conditions? So we also have certain conditions and diseases that, like I said, could lead to erectile dysfunction in the long run. Diabetes, because diabetes affects your blood vessels. High blood pressure, because that's hypertension, because it affects your blood vessels. High cholesterol, because if there's high cholesterol, what we call hyperlipidemia, there will be collection of fat along the linings of your blood vessels, meaning your blood vessels cannot dilate enough, meaning that there won't be enough blood flow to your penis that will give you a strong enough erection. You may have an erection, but it may not be strong enough. We have vascular diseases. I've talked about it, issues with your blood vessels, chronic kidney disease. Now, people don't know this. Kidney disease affects your erection. Now, it affects your erection because kidney affects the regulation of fluid in your body. Don't forget your blood is also a fluid. So, kidney problems can lead to maybe hypertension or diabetes, and it plays in. Atherosclerosis is a constriction of your blood vessels, not allowing your blood vessels to expand and dilate as they should to receive enough blood. I've talked about lower testosterone, things like stroke, that is a a neurogenic disorder affecting the nerves in your brain, so they can't send the right impulses. Epilepsy, injuries and trauma to the penis, like penile fracture. So if your penis fractures, meaning that the blood vessels there is ruptured, it will lead to erectile dysfunction. Then injuries to the pelvis bone. The pelvis bone is the and injuries to the spinal cord. That could also be a problem. Then we also have certain medication. I talked about it. Medication. So medications like antidepressant, anti-anxiety drugs, diuretics, blood pressure medication, chemotherapy drugs, all of them can play in and become a problem. Then other substances that you abuse, especially if you have addiction to alcohol, amphetamines, nicotine, marijuana, cocaine, opioids, and the rest, there can also be a problem. Then I talked about the psychological and emotional conditions, like if you have depression, anxiety, or stress, fear of sexual intercourse or intimacy, like genophobia. So these people already do not even want to have the sex because they're afraid of it, so they may not be able to perform. Low self-esteem could also be a problem, right? So who are the people at risk of having erectile dysfunction? People who are 40 years and above are more likely to have erectile dysfunction. People who have diabetes, people who have a body mass index that is over 25, meaning that you are mostly getting to becoming obese. People that are depressed, people that are physically inactive, and people that smoke are most likely to have erectile dysfunction. So how do we know erectile dysfunction? First is physical exams and physical history taking. So they will take your sexual history, how long do you have sex, how long do you have erection, how often do you have erection, and the rest. So they will ask how hard are your erection, how long are you able to maintain an erection, and so many other questions. Then there will be other tests, like there could be a blood test, there will be a lipid panel, there will be liver function test, kidney function test, thyroid test, testosterone test. They will analyze your urine, what we call urinalysis. They will do a Doppler ultrasound of your penis, right? There will be tests to check if your penis responds to vibration, what we call penile and bisexiometry, right? So all of this is done to see. There may be MRA, that's magnetic resonance angiogram, to check the blood vessels in your penis, as the case may be. So how is erectile dysfunction treated? So we have cardiovascular exercises. So that means to be that if you improve the functioning of your heart, you're most likely going to improve your cardiovascular function. In fact, as a rule of thumb, if you're suffering from erectile dysfunction, it's oftentimes pointed to the fact that you're most likely going to have a cardiovascular problem very soon. So cardiovascular exercises help. Quitting smoking also help. Talking to a sex therapist will help. Then there are medications that can be given, right? So if you know this is your problem, go to the hospital that recommended medication that could be given orally. There are those that could be injected directly to the penis to create stimulation. Then there are devices like penis pump that could be given to help with blood vessels. Then if the issue is testosterone, there's testosterone replacement therapy. There are also implants that can be put in the penis to make the penis hard. So we have penile implants. So for some people, your erectile dysfunction may go on itself if it was due to lifestyle factors. So if there are lifestyle factors, this will go by itself. So to prevent erectile dysfunction, please reduce your cholesterol intake. Be more physically active, move around a lot, do cardiovascular exercise, running, jogging, cycling, even walking. Take a good walk. That would be good for you. Then eat healthy food that are low in saturated fats, fruit and vegetable and whole grains. Have good quality sleep. Then stop smoking. Then reduce or stop drinking altogether. So if you know you're someone that is living with erectile dysfunction, please go to your primary healthcare provider or a urologist that are at a prime position to help you, as the case may be. They're going to help you to sort out your erectile dysfunction issues. There are drugs, that are treatment options for you, and we believe that if we do this, erectile dysfunction doesn't mean that it's the end. There are lifestyle modification, there are medications, both injectables, oral, there are implants that can be used that will help you. So this is what we have about erectile dysfunction. We talked about an overview of it, letting you to know that it affects more people than we actually give credit for. And we also let you know that it's also known as impotency, meaning that impotency is erectile dysfunction. Impotency doesn't mean you are infertile. It could just mean that you have the inability to have or maintain an erection. We talked about the types, from the one that is that is vascular to the one that is hormonal, um, to the one that is neurogenic to the one that is psychological. Then we talk about the different prevention. So this is the Intimate Matters podcast. Today we're talking on erectile dysfunction, talking about what you need to know, the causes, the risk factors, possible treatment option, and what is the prognosis and the outlook for you if you're living with erectile dysfunction. Go to your medical provider and they will provide provide you with the right services based on your diagnosis. Please do not self-diagnose yourself with erectile dysfunction. Always go to a recommended and a certified health service provider, and they're going to guide you on the right thing to do. So this is the Intimate Matters podcast. If you found value in this, please like, comment, share. If you have any question, please put it on the comment. Share this to everybody that needs to hear this. And you can watch all of our other videos. We have videos on contraception, on sexual and reproductive rights, on consent, on kink and fetish, on miscarriages, pregnancy, IVF, so many things that pertain to your sexual and reproductive health. Watch our videos, share these videos. Please make sure you subscribe to our channel. We have so many videos here that it's going to be of help to you and people that you may know around you. Please share it to them, share it to them. And know how to follow us on all our social media platforms, Facebook, on Instagram, on TikTok, and also join our WhatsApp channel. Then you get to interact with me and you get to interact with everyone there, and then you could suggest topics. If there are topics you want us to talk about, feel free to put it in the comment section or reach out to us in any of our channels and suggest this topic. We're so glad to have you today as we discuss erectile dysfunction. Thank you so much for joining us today. My name is Nosakwa Wokwan, the Geek Nurse. I'm the one that is taking you on this journey as it pertains to your sexual and reproductive health. On the Intimate Matters podcast, we believe that your intimacy matters, and that is why we're here. We're here again to talk about your sexual and reproductive health. And until we come your way next time, please do well to stay glued to this channel, go through our videos, and feel free to comment, to share, to like. Thank you so much. And this is bye for now.